Have you been diagnosed with blocked fallopian tubes and every doctor you meet says that IVF is your only option? In this video, I'll be breaking down what all are your treatment options and how you can decide what's the best one for you. Blocked fallopian tubes are one of the most common causes of female infertility, accounting for about 30 to 40% of all infertility cases worldwide. While IVF seems to be like the leading treatment option, it's not always the best one in my opinion. There are countless treatments that can help you restore your fertility and also allow you to conceive naturally. After all, why not explore all your natural options before jumping straight into IVF, right? Because nobody wants to talk about what happens if IVF is going to be a failure. So before we begin, please consider subscribing to my channel because I'm someone with no sponsors. I shoot at home in my room after my daughters go to bed, and the only purpose of making these videos is to educate and empower you to make the best health choices for yourself. Now, the fallopian tubes are two very thin, delicate tubes about 1 to 2 millimeters in diameter that connect your ovaries to the uterus. Their primary function is to transport the egg into the uterus and facilitate the fertilization by the sperm. When these tubes are blocked, it prevents the sperm and the egg from meeting, leading to infertility. Now, tubal blockages can be categorized into three main types: the physiological, the pathological, and the iatrogenic blocks. Physiological blocks are usually temporary and often are caused by muscle spasms or a mucus plug in the tubes. A study which was published in the Journal of Obstetrics and Gynecology found that approximately 15 to 20% of all tubal blockages are physiological and can be resolved without a laparoscopic procedure. A simple hysterosalpingography, also known as a HSG, where a dye is used to flush through the tubes, can clear these blocks effectively. So this particular test can be both diagnostic as well as therapeutic. But if these blocks aren't cleared by the HSG, a laparoscopic tubal cannulation is often the solution. In this procedure, a thin catheter is placed near the tubal opening, also known as the ostia, and a dye is pushed through it to clear the blockage. Now, if this blockage is very stubborn, a soft tip guide wire can be used to gently open it up. The success rates of such a procedure is about 70 to 90% when performed by an experienced surgeon. Pathological tubal blocks, on the other hand, result from diseases or conditions that damage the fallopian tubes. One of the most common causes is the pelvic inflammatory disease, also known as PID, which is often caused by untreated sexual transmitted infections like chlamydia or gonorrhea. In India, however, pelvic tuberculosis remains the leading cause of tubal damage, according to about 18 to 20% of all infertility cases. These pathological blocks form a condition called as hydrosalpinx, where the fallopian tubes fill up with fluid, preventing the egg transport and causing infertility. Research shows that 1 in 8 women with PID experience tubal damage, significantly reducing their chance of conceiving naturally. Now, we can go on debating whether these tubes should be clipped or removed. In my opinion, removing the pathology from the body is always a better choice than clipping the tubes and retaining the pathology within, because this improves the chances of successful fertilization if the other side tube is healthy. But for women who have bilateral hydrosalpinx, where both the sides are affected, removing both the tubes and opting for IVF is usually the best choice. Another pathological cause is endometriosis, a condition wherein the tissues which are similar to the uterine lining grows outside it. Now, this creates an inflammatory environment leading to swelling, scarring, and kinking of the fallopian tubes. Such tubes are often misdiagnosed as hydrosalpinx during ultrasound. However, unlike hydrosalpinx, a laparoscopic correction can often restore this tubal function. Research shows that laparoscopic treatment of mild to moderate endometriosis can improve your pregnancy rates by around 40 to 50%. Now, I made a dedicated video on how endometriosis causes infertility, so make sure you check that out after you watch this one. Iatrogenic tubal blocks are caused by previous surgeries involving the ovaries or its surrounding areas. Improper surgical techniques can lead to scar tissue formation, which blocks these tubes. These blocks can only be restored by an expert surgeon trained in restoring such damaged tubes. Another rare cause of these tubal blockages is the chronic ectopic pregnancy, wherein the remnants of an ectopic pregnancy persist in the tube even after medical management. I have treated such patients and was successful in connecting the tubes after excising this ectopic sac. These procedures have a success rate of about 90%, and if you are interested to watch that video, please click the link that pops out here. Another way to classify tubal blockages is by their location. Proximal blockages occur near the uterus while distant blockages occur close to the ovaries. Now, identifying the location of these blockages are crucial because it determines the most effective treatment. Now, you might wonder, why not just go for IVF? IVF is a great option, especially if both your tubes are damaged beyond repair or if you're older and you want to avoid any delays. However, IVF does come with its challenges. It is emotionally, physically, and financially very taxing, and worst of all, it isn't foolproof. Because the global success rate for IVF is only about 35 to 40% per cycle, and that too for women who are under 35 years of age. And pre-existing hydrosalpines can also reduce your IVF success rates, which is why it's essential to address these damaged tubes beforehand. So now, how do you choose the right treatment for you? Your choice mainly depends on a few key factors like the type of blockage, your age, and your personal goals. Younger women tend to have better success rate with tubal surgeries, while IVF may be the faster option for older women. A fertility specialist will guide you through the best approach based on your specific condition. But if you ask me, I'd recommend exhausting all your natural options before considering for IVF, especially if your tubes can be treated. The most important step is to consult a fertility specialist who can tailor the right treatment approach for you and not just push you towards IVF. If you found this video useful, don't forget to like and subscribe, and please share your thoughts in the comments down below. Are you dealing with blocked fallopian tubes? Have you tried any of the treatments I have mentioned? I'd love to hear your story. Thank you all so much for watching, and I will see you in the next one.